I love this. We're having an active chat already with participants from all around the world, from Toronto to Espoo in Greece and Geneva and Boston in Switzerland. That's brilliant. I'm going to turn off the chat for myself for now and welcome you to our Wellbeing Strategy Masterclass. Really thrilled to have you all here. This session is being recorded, so if your colleague or friend misses it, please do feel free to share the recording afterwards as well, and we'll be sure to do so too. Our objective for today is to reframe well-being as a prerequisite for both human performance and business performance as a fundamental part of our strategy. And what we want to do today is make it quite practical, which is why I am extremely happy and privileged to be joined by my amazing colleagues in the discussion. I'll let Dr. Noémie Pertel introduce herself in a second, but we also have on the line Eveliina Dahl, the Senior Vice President of People and Procurement for Fortum, one of the leading energy companies, clean energy companies in the Nordics. We have Sarah Nutolo, the Global Head of Talent, Culture and Inclusion from Reckitt, the multinational behind some of the most beloved brands in health, hygiene, and nutrition. And of course, Chris Cummings, the Group CEO of Wellbeing at Work, who will be facilitating the discussion. We're really lucky to have you here, Chris. Thanks for joining us. Noémie, would you like to introduce yourself briefly?
Sure. Would you like to introduce yourself first, though?
I was going to go last, but sure. My name is Annastiina Hintsa. I'm the co-founder and CEO of Hintsa Performance. And over to you.
Thank you, Stina. It's such a pleasure to work with you always and to see this come to fruition. So, I am the CEO of the Institute for Global Flourishing, and we help organizations and leadership on their workforce solutions, typically change initiatives and really scaling sustainable change when it comes to workforce flourishing and engagement. So, helping people in the organization thrive while hitting the bottom line. So excited to be here.
And Noémie and I have, of course, been working on this Wellbeing Strategy white paper for the past year, which really has been a privilege. And we're very, very excited to be sharing this with you. We're also really looking forward to hearing from you. So as I said, we would like to make this practical. We would like to make this relevant. We'd like to make this a discussion. So we're going to be using the Mentimeter to get your thoughts and your input during the session. So if you can, please go to menti.com, enter the code or scan the QR code, and be ready for some questions down the line. I'll give you a few seconds, and don't worry, you get to scan it later on too. Also, you have already discovered the chat. Please use that for discussion, use that for comments, use that for questions. And if you have any technical questions, that's a place to go to. There's also a Q&A chat next to it. If you have questions directly to the panelist, you can pop them there. And then briefly, the agenda for today. We're going to shortly give you a brief context or scene setting with Noémie. But three themes that we want to actually cover in the discussion and in the panel. Number one, why should you really be considering well-being as a part of your strategy? Why well-being? Number two, what do successful well-being strategies actually look like? And number three, how can you measure impact and create accountability? And without further ado, Noémie, would you like to get started?
Thank you so much, Stina. Well, thank you everyone for joining us today. And really, this is the context and the heart of why we're bringing everyone together. When we're looking at well-being, oftentimes it's thought of in organizations as a perk, a nice to have, but very separate from business outcomes. But what the research shows is it has a direct impact on performance and organizational health. So we'll be going deeper into this. But first, I'd like to talk a little bit about context. So, according to the World Economic Forum's last Future of Jobs report and the state of the world, we are emerging in a polycrisis or permacrisis. So, a confluence of factors that are impacting the economy, the political landscape, geopolitical tensions, and impacts on climate and sustainability. So, why is it important today? Well, when you look at this future readiness of organizations and their workforce, 8 of the top 10 skills of the future are human skills, and they're directly impacted by well being, and resilience being one of them. So, when we look at the data, we know that boosting employees' well being, it helps really enhance engagement as well as energy. But also loyalty. So, as people are demanding different things in the workforce, being able to retain your top talent and attract new ones is really a strategic advantage. But today we're going to talk about how is it really a strategic advantage and how can you be more strategic about your well-being strategy so that you align it with the business outcomes you want to see. So this is a slide showing the differences in the organizations that are performing the best when it comes to their well-being and how they perform as an organization on the Dow Jones. And since 2021, particularly as things have shifted with the global pandemic, you can see that it's gone up 20% in terms of how they outperform others in their rank. And so this is just one example of how organizations who really care for their people also benefit in terms of business outcomes and sustainability from a business and impact perspective. Off to you, Stina.
Thanks, Noémie. Between us, we worked with over 500 organizations, from Formula One teams to Fortune 100, Fortune 500 companies. And when we looked at those organizations that actually outperformed their peers, and when we looked at what did they do in terms of a well-being strategy, we identified 10 different dimensions. I'm not going to go through them in detail here, but I'm just going to highlight a few. Starts with defining why well-being. Why is this actually important to you? How does it create value in your organization? Is it about the talent, or is it actually about safety? Is it about, customer experience? What's the real driver that you're trying to influence? And then we looked at things such as leadership, culture, and fundamentals like, balancing job demands and resources, or your processes and systems and structures that support. We also saw some pretty interesting differences between different types of organizations. Some of the key takeaways from our research showed that most of the companies actually claim that they have a pretty good well-being narrative in place. What they lacked was a holistic long-term plan. How do we actually make this happen? And almost half, 47%, said that they lack the appropriate resources. Very few companies actually measured systematically the impact of well-being initiatives and well-being across the organization, and only 28% offered any kind of targeted support to specific groups. We also saw some pretty big differences in job demands and resources between small, medium-sized enterprises and large corporations, which is something that I'd actually like your opinion to, if you want to pop that in the chat. What do you think could be driving that? And as Noémie said, we are in a challenging environment, polycrisis, permacrisis. We have demands that are increasing year on year. And at the same time, a lot of organizations, what we hear is we're asked to do more with less. So how do we do that? I actually claim that we need to be more deliberate about how we target those interventions. And to make it more practical, on the left-hand side, you see an example of an analysis that we did as a part of a strategy process for a global organization. We looked at job demands and we looked at resources, and we identified specific teams at risk and implemented specific interventions for those teams. As we have this challenging environment, as we have more and more limited resources, I think we need to become more deliberate about how we reallocate those resources and to what end. Prioritizing initiatives and groups with the biggest potential for impact and ROI, which leads me nicely to the final point around measuring impact and holding accountability.
Thank you, Stina. Yeah, so when it comes to measurement, what we measure really conveys what it is that we value as people, as organizations, and those metrics are really important. And so when we're looking at doing more with less or being more deliberate and intentional with our resources, we really need to think about, are we capturing the right data so that we know how to target those interventions? Oftentimes, learning and leadership development solutions can be sort of on trend, right? Like what is trendy, what's popular, but that's not necessarily evidence-based. And so what we're going to talk about is how to use data, select the right data so that we are capturing actionable strategy that will actually have an impact. And how do you measure efficacy?
Thank you, Noémie. And with that, I think we want to get a bit more practical. So, Chris, I'm handing over to you to open up the discussion to our wonderful panel.
Thank you so much for a wonderful introduction, and thank you for inviting me to join you on this wonderful webinar. My name's Chris Cummings. I'm the CEO of Wellbeing at Work, and we organise leadership summits around the world focused on wellbeing in the workplace. So delighted to be here. So lovely to see so many people join the webinar from all around the world as well. Some amazing locations here in the audience. So thank you for joining. I'm going to turn to my panelists and ask them to provide a short introduction to themselves. I'm really honoured to be joined by a wonderful panel. Sarah, I'm going to come to you first for a brief intro.
Absolutely. Thank you very much, Chris, and thanks, everyone. My name is Sarah Nutolo. I'm the Global Head of Talent, Culture and Inclusion at Reckitt. I'm based in Milan, where I live in a dual career relationship with my husband and our 3-year-old twin girls, which might suggest I'm not a big user of one of our big brands, which is Durex. Nice to meet you, everyone.
Wonderful intro. Thank you so much, Sarah. Eveliina, over to you.
Thanks, Chris. So Eveliina Dahl, I'm leading people function and procurement in Fortum, and as Annastiina already introduced, Fortum is a leading clean energy company in Nordic countries in Europe. I'm based in Espoo, so close to the capital of Finland, Helsinki.
Wonderful, thank you very much. And obviously the audience have already met Stina and Noémie. So we're going to dive straight into that first theme, and it's that long-term perspective. Why should you consider well-being as part of your strategy? And before we dive into the conversation with the panel, we're going to load up Mentimeter for our first bit of audience interaction. So here is your first question. We'd love you to take part in this. So you've got the QR code there to scan to load up Mentimeter. But the question is, what are your organisation's biggest challenges regarding wellbeing and performance at the moment? So if you can please scan that code and start bringing in those responses, and then we can talk those through. Wonderful. Here they come. Leadership buy-in, doing more with less. Yep, that's good. That's going to be our second theme, doing more with less. So very timely. Measurement's going to be our third theme of the webinar. So we'll certainly cover that. You're in the right place. Lack of resources, again, doing more with less. Leadership commitment. Wonderful. Thank you so much. We'll keep those coming through, and I'm going to dive into the to the panel discussion now as we start to see the lack of business case to convince leadership team. Yeah, you're in the right place. We're going to tackle all of these, and really appreciate you taking part in Mentimeter. That's really good. So, Sarah, I'm going to come to you first. Obviously, you and Eveliina work in different industries. Keen to know from your perspective, Sarah, how your organisation has been investing in wellbeing for multiple years to get that long-term approach, and why is wellbeing so critical to your organisation?
Yeah, thank you, Chris. So I would start by saying what well-being is not, or is not just, because I believe well-being is not just about caring for people's health, minimizing illness, reaching higher productivity or profitability even, and lower turnover. Well-being is actually an integral part of the culture any company wants to create, because it's part of the behaviors people put in place. It's the smell of the place, it's the shadow we cast as leader, it's the seat we bring at the table for everyone to sit in. So in a true inclusive way. So it taps into so many areas of leadership as a whole. So in Reckitt, for instance, it means to realize a place where everyone can be the true self and every day, and where people are also encouraged to do the same. So we have approached well-being, starting with creating a culture of well-being first, by upskilling people on how enduring well-being ambitions is already a better life, full stop, as we define it. So then, offering performance coaching was a second step, because then it means offering it to our senior leaders and to our people leaders. So to make sure first there was a fertile ground there, and then second, for them to cast their leadership shadow throughout the organization. And then we have expanded it to the entire company to create a common language for everyone. So this is, I believe, specifically to Reckitt, very true to who we are, because we exist, as our purpose would say, to protect, heal, and nurture in the relentless pursuit of a cleaner, healthier world. So we are just starting with our own people.
Wonderful. I love that, a culture of well-being. That's beautiful. Thank you so much, Sarah. And Eveliina, interested to get your take on this from your perspective.
Yeah, as we are industry where safety basically matters. So we have, for example, nuclear power plants. So that's the license to operate or have even a business. So for us, as like well-being is part of the safety culture. So mental well-being and so on. So that's how you create safetiness, and that's the point where we come from this picture. But I would say that we have actually taken the exactly same step that Sarah is also saying, that starting maybe a bit more like getting the leadership buying it, then cascading for the leadership. But I think the crucial part is that how you offer then the services for the whole organization, which I think has been one of the success of our program.
Amazing, thank you, Eveliina. And just turning to you, Noémie, on the Mentimeter feedback that we saw, and those challenges that the audience are facing. Very common themes coming through on Mentimeter, and I'm sure those some of the challenges that you've seen in your work.
Thank you. Yeah, I'm not sure if we can show those results. I think that would be interesting for the audience, but everybody can see it through the link as well. So I would say, a lot of these struggles are similar in terms of well-being strategy maturity. So oftentimes when you're starting out, it can be a compliance, tick the box, right? Like the evolution of many changes and transformations. So that's where you're gaining buy-in, right? You're using the interventions to really build momentum and really have a clear focus. And then there's a sense of embodiment where the workforce is looking to its leaders. Are they living this? Do they really value it? Right? Can I trust this intervention? And then it's matching the resources so that people can thrive, and then embodying that within the systems, right? So how do you do that at scale? How do you delegate all of your energy, resources, finances, time to make sure that people can have that support that they need to deal with their stress? And so tying it with incentives, I think, is the next level, right? So do your performance evaluations, the way that you progress in the organization, is that linked to the culture that you're trying to create? And so those are some of the themes that I've seen in different organizations. And so I think having the measurement is really a key differentiator, because when you actually get the data of how things are working, you can customize those interventions not only to your industry, the culture that you have and the culture you're trying to create. And so again, using that evidence base tied with the voices on the ground from the people, those are some of the themes that I've seen for a successful well-being strategy that's reached its maturity.
Fantastic. Thank you all for contributing to that first theme. I think I would add around that patience piece. We live in a world where we need we have that immediacy all the time. We have to have results tomorrow, and actually, stepping back and being more strategic, looking more longer term, that's when the real results start to come. We can't do this with quick fixes, and we have to think more longer term. So thank you, panelists, for covering that first theme, and thank you to the audience for being involved with Mentimeter. I'm going to be asking you again to contribute now on our second theme, and certainly the challenges that you've been facing here. Doing more with less, the lack of resources, budgets, things like that has come up quite a lot. So that's the second theme. How do we do more with less? And again, we're going to bring up Mentimeter. This is a bit more of a simple yes or no answer. So we have the appropriate resources to execute our plans for employee wellbeing in 2024. Yes or no? Okay, I think there's a clear winner coming through. Thank you. And as that graph is updating in real time, I'll start the panel conversation again on this theme. And I guess what we've seen in recent months, especially with budgets being squeezed and spend being really analysed. I'd like to come to you, Eveliina, first, and talk about some of the biggest learnings that you've had along the way with close collaboration with occupational health, and how you've made that work with doing more with less.
Yeah, I think we have quite a unique situation. So we have especially in Finland, still the occupational healthcare inside the company. And I think that has been one of our success case, like how to collaborate together, like as a HR, then occupational health, and then well-being service providers, and then of course with our managers. And I think it has helped in a way to identify early enough the targeted measures or targeted actions for certain groups, because I also believe that it's important that you have services available for everyone, but same time, as Annastiina was also saying, that you need to identify also that spot that needs, for example, special attention. And there I think like working tightly together with the occupational health has been one of our success cases.
Wonderful, thank you, Eveliina. And yeah, certainly collaboration within the organisation is definitely going to help us do more with less. Sarah, interested to get your key learnings along the way from your strategy.
Yeah, with pleasure, Chris. So I would say, first of all, that any program requires time to start. So to start, to get traction, to be integrated in the ways of working, and then embedded globally. And in my personal experience, this is around 3 years. So whenever we talk about a cultural evolution, like well-being is a very important cultural piece, you need to be patient. This would be, and that's learning number one. The second thing is, I think, in the communication space. So the second learning is more around how to communicate to people. And while it might sound obvious, the moral case does not suffice in most cases, because now more than ever, people need to understand why they need to dedicate time to participate to programs, to attend webinars, to participate into performance coaching. And therefore, we need to give them the what's in it for them as individuals, but specifically as leaders. If you position it in the right way, and therefore I highlight and underline what's in it for them, and how joining a program like this, like the one we have partnered with Hintsa for, will really boost their leadership, it's really a no-brainer. And then let's say, then it's not just because it's important for the company, but it becomes because it's important for them. And then at some point, the messages will be so reiterated and the buy-in will be so high that the word of mouth will start within the organization. And then this is where, you know, you have reached your objective.
I love that. Yeah, it's really about using the language, isn't it, to connect with the different parts of the business, and you know, like you say, what's in it for me? If we use the same language for different types of people within the organization, we're just not going to get that engagement level. So love that. Thank you so much, Sarah. And Stina, I want to bring you into the panel discussion. You've been sitting there very quietly, so we're gonna rope you in. So wanted to get your thoughts around how organizations can be more deliberate about how they're investing in their talent resources for well-being.
Thanks, Chris. I've been listening. This has been great. I loved it. And both Eveliina and Sarah already spoke a lot about the kind of learnings along the journey that we've had over the last many years, actually. It does take time. I think that is the number one learning. But I think it was actually Eveliina, you that said that it's not necessarily about the size of the investment, but the consistency of the investment. Having a consistency across the years, even with little, you can actually achieve a lot if you manage to stay patient and keep sort of building on year after year. So I think that's the kind of learning number one. The consistency really matters here. It can't be something that, well, we've seen this a little bit. A lot of organizations did a massive well-being boost resilience thing around COVID, and then because we didn't really think about why, where, how we were investing those resources, we didn't really see the impact. We weren't really able to measure the impact because we didn't really know what we were measuring. We then pull back resources when it gets tighter or squeezed. And that sort of pendulum effect, of course, is not what we're looking for. So I think consistency, number one. And number two for me would be actually going back to that well-being narrative, going back to the why. Like, seriously, what are you looking for? What is the outcome, the end goal that you are really trying to achieve? Is it about the safety, as Eveliina was pointing out? Is it about leadership skills, equipping the leaders? Is it about customer experience? Is it about talent retention or preventing burnout? Going back to your kind of burning platform around this. And I know that most of us as organizations do actually have a burning platform right now as we're looking into the 4th, 5th year of kind of perma-poly crisis. It starts to feel like one wave after another for many of us, I'm sure. And then I think the kind of final piece goes to the little graph I shared already earlier as just to repeat. It is about sort of identifying, using the data that you already probably have. A lot of organizations, you are measuring engagement, you're measuring resources, you actually probably have already quite a bit of that data in-house. It doesn't mean that you need to do an extra survey or something of sort. You probably have that already. And it is about sort of identifying, going back to the question, what are you really looking for? Identifying the potential groups where you might have either the biggest risk or you might have the biggest opportunity, biggest potential. It's a critical team. It's your transformation team. And sometimes it's not even a massive data exercise. Sometimes it actually is the leadership team sitting together and really talking through and walking through what are the most critical business outcomes that we're looking for to achieve next year. Who are the people, who are the resources that we need to achieve those outcomes, and how are we making sure that those people are at the top of their game in 2024? So really kind of tying back to the business outcomes for me.
Excellent. Thank you so much, Stina. That was great. And I really like that consistency of investment. I think, you know, organizations, rightly so, we're almost in panic mode during the beginning, the early stages of COVID. So we wanted to support our people as quickly as possible. And I think you're right in terms of now looking at that consistency and more longer term measurement is certainly where we want to be. So excellent, wonderful. So we're on track. We're now moving on to theme number 3 for us. And I know this came up very early on about measuring impact and creating accountability. And once again, I'm going to be asking you to pick up your phones and get involved with Mentimeter. So the question we have for you now is what type of KPIs do you have in place to measure health and well-being in your organization? And many of you have already completed this, which is great. So there's some there saying sick days, mindset factors index, stress KPIs, level of energy, responsibility of the leader. We have anonymous from 2 to 3 times a year. Do we allow on responsibility to raise the alarm and speak up? Love their employee engagement. Yeah, really good stuff in here. So thank you for that. Really appreciate it. And before we dive into the discussion on this theme and come to our panelists again, I just wanted to remind you that we've got some time at the end for Q&A. You've got the Q&A function just at the bottom of your screen, so please fire those questions in and we'll try and steer those into the panelists later on once we've finished this this third theme around governance. So Sarah, I'm going to come to you. Quite a straightforward question on this. How do you measure well-being and create accountability in your organisation?
Yeah, sure. So let's say we have different ways. So I see from the replies, first of all, that while a number of us don't have any measure in place, or they are looking into building them, some of us also have very advanced way of measuring it with very relevant indexes. So as far as we are concerned, so we have created a series of measures in collaboration with Hintsa that we track monthly on reach, penetration, but not only. So because of course we look into our employee engagement survey, we connect the dots with what the responses of our people are to make sure that we capture the trends and themes coming from the survey itself, because it's the freshness of the data that makes sense. So we are looking forward to some new features that we are implementing in 2024 to capture themes even more in depth from our employees, but also there are many interesting insights coming. So someone cited ROI before, and therefore you can measure your own ROI based on the different groups within the organization, those, for instance, who go into the performance coaching and those who don't. And then it's easy to compare and come up with a very relevant ROI and business case. So, and therefore, this is something I would love to say, this is something we have done bespoke for us because it worked for us. And I think from this perspective, everybody can find their own recipe that works for their own company.
Amazing, thank you. And I think, as we said before, a lot of this data is already there as well, and it's being measured, maybe not being reviewed completely all the time on a regular basis. So, many of these things are in place. I'd also mention around the employee surveys and getting feedback from employees. I think that's stage one. Stage two is actually listening to them and acting on them. So that's certainly something that I've seen. If we're going to ask employees what they think and take a temperature of the organisation, we're not going to please everyone. We can't do everything that everyone requests, but we should certainly try and at least feed that back. So Eveliina, keen to hear about your measurement piece.
Yeah, thanks, Chris. I think there was many already in the screen. So we have these kind of typical like a sick leave, and then we have employee voice survey where we have our own section for the well-being questions, so well-being index. Then something unique for our countries is that it's also reflecting the pension premiums. So we see immediately cost also through that one. But then I think many of these are like lagging indicators. So what we have now looking like leading indicators is that part of is actually our short-term incentive. We have this kind of well-being toolbox discussion that we are following so that the leaders are expected to have monthly discussion on certain topic, where we have created then as a team material to facilitate those discussions. So for example, about resilience or nutrition or something like that. And then we are measuring that leaders are having those discussions. And I think it's important in the same way that we have when we are measuring safety in the power plants. So you have lacking indicators, but then you should have also leading indicators. So I think combination of these is important for measuring your success.
I love that, the wellbeing toolbox. I'm definitely going to be highlighting that in my sum up. So Noémie, just wanted to bring you back in. There's the $1 billion question really around well-being when it comes to the organization. Is it a person? Is it a function? What is it in your view?
It's a great question. So when I think of well-being, I think of it as from a systems approach. So I think of it as the different functions within the organizations are communicating in a healthy way. The processes are sustainable. So I look at it from a bird's eye view, but also the individuals, right? So when you look at all the individuals at scale and you see how your people are doing, then you can get a sense of the culture. And so I think there's no one answer. I think you have to look at it on a micro individual level, on a meso or team level. How are people engaging with one another? Are they collaborative? And then also from the organizational level, I look at it more from the business. So is the business healthy and well? And is that culture and also the brand sustainable? And is it the vision that you want it to be? So is the experience from an employee perspective aligned with the brand and the vision and the mission of the organization? And so I look at it from those 3 layers. And I think from a governance perspective, it's important to think about, oftentimes we think we need one person, and that can be effective in some organizations. So you have a well-being leader in the C-suite or who works with people in HR. And others say, we roll it into all our processes. So it's within our KPI across the business. Well-being is measured. And so I think there are different ways to look at it, but the way that you measure it and that you make sure that it's important and communicate that to your people, I think is most important. So I think in this day and age, we have to address it in our organizations.
Awesome. Thank you so much. So some wonderful highlights for me from those 3 themes. And thank you so much to the wonderful panelists for playing your part and providing some great insights. I've taken lots of notes here. I can't run through everything in my roundup statement, but certainly a culture of well-being, being patient to gain the buy-in, taking that longer term perspective, really great stuff there. Doing more with less, certainly collaboration. Eveliina talked about that, using the right language, what's in it for me, why should I get involved in this, and consistency around the investment piece. And then the measure part, tracking monthly, the wellbeing toolbox that Eveliina talked about, the monthly tracking that Sarah talked about, and that cost measurement piece. Really great stuff. So thank you all for sharing your insights. It was an awesome discussion, and I'm sure the audience really appreciated it too. Thank you to the audience for playing your part on Mentimeter. That was awesome. Really appreciate that. And yeah, want to hand over to Stina now and have a wrap up from Stina.
Thanks so much, Chris. I think we have some nice questions also from the audience that we might still wanna pick up on. I'm reading a few about sort of going back to the measurement piece. How do you know that you're not capturing feelings but actually well-being? How many of the respondents actually, that was interesting for me too. I saw quite a few measures around heart rate variability, sort of more physiological measures. How do we know that organizations are actually equipped to deal with these measures? Yeah, that's a good point. Are they? maybe just kind of going back to that piece for a moment. I think we touched on it, and I think both Sarah and Eveliina provided great examples of what they're doing in practice, which for me summarizes it quite well. What we have been doing with organizations we work with is, like was mentioned, it is unique to each organization. One size doesn't fit all, but we do have to think about it sort of as we would think about any other balanced scorecard. You have your leading indicators, you have your lagging indicators. The way that we kind of structure it most often is that we are looking at sort of the participation, penetration, your kind of engagement metrics. We're looking at individual satisfaction metrics. Is what we are offering actually, is it what you need, what the audience, what the employees actually need right now? How satisfied are they with the scope, with the work that we're doing? We would then look at two things: individual outcomes, so individual health and well-being outcomes, and there are different ways of measuring that. I think the audience already listed quite a few. There are indeed physical ways of measuring that, very objective ways to look at it. There are also surveys. We run our own survey, etc. There will be sort of, occupational healthcare might run their own surveys, etc. You might look at occupational healthcare metrics. It really is, depending on the organization, kind of pulling in different data sources as well to create an aggregate view. And then there is the final interesting piece, which is the business outcomes. So not just looking at individual level outcomes, but looking at the business outcomes, which again goes back to that bigger why. So is it about sick days? Is it about talent retention or turnover? Is it about customer experience? Is it about safety incidents? What's the real thing that you're looking for? So I think kind of building that scorecard for me is one way of trying to prevent that you're not just capturing sort of one engagement score. And we sometimes confuse engagement with well-being. It's not always 1-in-1, even though there is a correlation. I think we do need to, similar to anything that you would do in business, you do need to create a little bit of a balanced scorecard that fits you. That would be sort of my take on that one. And I don't know, is there another question, Noémie, that you would like to pick up on?
Thanks, Stina. Yeah, I would add to that. It's a really interesting question about feeling. You just capturing feelings, because in the well-being research, most of it is subjective, right? So it really comes down to our feeling. No one else can tell you if you're thriving in life, but perhaps someone might say if you're thriving in work based on your performance. And so back to this data question, because I'm seeing a lot of them here. Recommendations for organizational well-being KPI topics. I would just add that you can do both. You can have the objective quantitative data, and you can have the qualitative. And, indeed, you probably want both. And so a combination of focus groups and interviews and listening to the voices of people, and then having those harder metrics, which are usually organizational, can be a really great way. And so that's something, and we can share some other resources and models that we have to follow up to this webinar so people can have more reading. And so I think most of those questions are around data, but in terms of measuring well-being and building the culture in a small organization, maybe I'll just say a quick word on that. I think that again, you go through the different phases of maturity, but if you're smaller and you have access to your people more directly, you might be more resource constrained when you're smaller and building your organization, but at the same time, you're interfacing with everyone. And that's an advantage too. And so when we look at building those cultures of care, it's really not just the individual, but how any individual within the system would measure how people are being treated as a whole. And that comes down to leadership qualities of building trust, fairness, safety, and helping people deal with stress. So a lot of these pathways to well-being. So we talked about the leading and the lagging indicators. Think of it as inputs and outputs, but we have the pathways. And those pathways, once you measure those, can help inform what levers need to be pulled. And so again, if you can measure how any individual would rate their leadership in terms of those caring culture behaviors that impact well-being, I think we can get at the facilitators of that as well in a small business and a bigger enterprise.
I would build on that. I think there's two reasons why a small business or a small and medium-sized enterprise should focus on their leadership and the leadership skills. Yes, they have a cascading impact on that shadow that Sarah was talking about. Also, for a small business owner, they usually have quite a lot on their plate. They're
So
usually
true.
playing more than one hat. They're wearing, I'll raise my hand here, five hats at a time. And that puts a lot of stress. It's also a higher risk because there is so much pending on that one person sort of leading the way and paving the way and keeping things running. There is often no backup. So I think that those are two reasons why I would really start with the leadership well-being from two perspectives. One, looking after the leaders, equipping the leaders to look after themselves, and then equipping them to actually lead the well-being and well-being culture of their organization. And that for me would be, I think there was, what would you start with? Building a culture of well-being in a small company. That for me would be the number one place. There was maybe one final question. I don't know, Chris, but there's one question to Eveliina around leading indicators in an SME company. Do you want to pick up on that, Eveliina?
Yeah, I was thinking on that one, and I think we have a long experience on safety, like how to create KPIs there. And I said that there also we are now moving from the leading indicators, which are actually usually action-based. So I believe that you have the expertise to create actions or a request for the organization that you know that these are the right. Then if you follow up that those actions are completed, then you should have in the long term right direction on your well-being. So as said, for us, it's this year, this well-being toolbox, and I think it has helped a lot. So when you have it as a KPI that or each leader should have with their team every month, those kind of discussion, it helps. Then those discussions are kept, then all the employees get the same information, and that way you progress in your journey.
I think that's
Wonderful.
I quite love that. Chris, do we have time for one more question to Sarah?
Yeah,
Or are we
absolutely.
already?
Yeah, please do.
I think there is one that, Sarah, you would be well positioned to answer around. If the leadership team hasn't bought into the well-being strategy yet, how would you recommend building that buy-in other than engagement numbers?
Yeah, I think, again, it's not just engagement, as I said before, is providing the proof and the ROI that comes from your own inside experience. This would be number one. And second is more around the word of mouth. They might not be engaged in it enough, but maybe the real engagement can come from the bottom. And then it becomes more of a, proof situation where it's a pull rather than a push. And therefore, this is where you might get buy-in.
I would just add to that as well around, first of all, there's usually someone in the leadership team that has a connection to this. So trying to find someone within that leadership team who is on board, and then really working on them. That was certainly the case where I used to work. So that worked well. But also, if you delve into the metrics of an organization, it might be, talent attraction or retention. There might be something really quite strong within the data that you can find that will actually talk to that leadership team as well. So often if we go to the leadership team and say we want to spend X amount on well-being of our staff, that's not necessarily enough. But if we can solve some of these major issues that the C-suite are facing, around talent, around performance, and start to talk their language, then I think you'll get a lot better buy-in instead of it being a sort of, please give me X amount.
That sounds like a perfect summary. And I think we're sort of heading towards the what keeps the C-suite up at night? Exactly the question. I think we're heading towards the end of the webinar, and I think this is actually a really nice place to wrap up. What keeps the C-suite up at night? I think well-being is a prerequisite to achieve whatever that is. Because whatever the answer to that question, it probably involves your people. The people that you have hired to do a certain job, And then I argue that a lot of the times we still sort of the way that we're working and deploying those people, that our most important resource, is often quite unsustainable and actually probably not optimal for their performance either. So I think that really is hopefully, if you're taking one thing away from this webinar, is that well-being is a prerequisite. It's a prerequisite for us to do whatever it is that our organization is designed to do, whatever our mission is, whatever our vision is. Well-being is a prerequisite for us to be able to achieve that. It's not a perk. It's not a thing that you do because you're a great employer, even though you want to be a great employer. It actually is a prerequisite for you to be able to succeed. It applies in sport. It applies in business. And I want to thank once more the wonderful panel. Thank you so much, Sarah, Eveliina, Noémie, and Chris. Thank you, everyone who asked questions and participated in the discussion. I thought this was very insightful for me. And please, if you do have any further questions or points that you wanted to either share or ask us about, please let us know, and we would be delighted to continue the conversation around these topics with you. So thanks once more, everyone, for joining.